Well, hello, greetings to you, and welcome to our Q&A session today. And as always, whether you're here watching me live or whether you're watching this as a replay, you can do the same. If you have any questions, you can just go down below the video to the comment box, type your question, and as I say, live, I will answer you here and now, or um, after the fact, I will bring your question to a future video. So either way, you're covered. And I do have a question to start us off with, if you're thinking of what your question is for today. The question is a very common one, and it comes in various forms. But the essence of the question, whether before somebody starts their Heilkunst treatment or during it, they kind of they take on some other therapy or whatever. The question is whether Heilkunst can be done at the same time as other therapies, other modalities, even drug protocols, and people, and it's a very good question. People want to know, at the most fundamental level, will the will the two therapies interact with each other in a bad way? Obviously, we don't. I guess we don't mind good interactions, where we get more benefit. But yeah, it's the negative interactions that people are avoiding now, particularly with when you get into pharmaceutical drug protocols and the whole allopathic medical construct. Most doctors, are very well. They're very uneducated, about natural medicine. By and large, most of them, of course, there are exceptions, but they will often give the advice to stop everything else. If a patient is brave enough to tell their doctor that, oh, I'm doing Heilkunst treatments, most doctors will say, "Oh, you have to stop that, and we're going to do this drug therapy now." They have this very absolute, wrong interpretation, but very absolute, that no, no, you can't mix those things. That's going to just cause problems, and it's going to throw the activity of the drug off course, and we're not going to get the effect we want in your body. So at that level, that's kind of implanted in people, not to mix a lot of different things with drug therapies. And even at another level, there's a wide range of knowledge about how certain nutrients can even interfere with the effects of certain drugs. They'll tell you not to take vitamin B or something like that if you're on this given drug, whatever it is, because there are known interactions. So that's a like a very valid set of concerns. Yeah, we don't want the negative interactions, especially with drugs and the side effects. But where we come from, with this general question, can you mix, Heilkunst treatment with other modalities, other drugs, or whatever? The general blanket answer is yes. In this kind of generic way, we're starting with this question. But as always, we have to get more into the individual features and structure of a given case. Then we're going to get even much more specific with our answers. Like, well, yes, you can put A, B, and C together, but you hold off on D for now. I'm just making up a generic kind of structure of an example, but on like in the general case, as I'm saying, yes, there can be different things being done at the same time. But that being said, we have to still be careful and specific. We have to still draw on our very thorough approach to diagnosis of a case, understanding it in all its dimensions and what is going to be needed in that case, now and as we go forward through the different stages of the case. So how, in our Heilkunst medicine, we talk about sequential therapy, that has that very specific meaning to treating the timeline. The sequence is, you treat this trauma, then you work on to this one, and there's a sequence there. But we can have an even more expanded idea of sequential therapy, not just within the specific Heilkunst modality, but we want this more precise sequencing of therapies, plural, where, oh yeah, well, first you need to have a massage treatment, to loosen up your shoulder, and then you need this treatment, then you need this modality, then we're going to do this in your nutrition. So we kind of get this broader idea of a sequential therapy across therapies, right, where you're properly putting them in sequence. So that kind of starts to open us up to this bigger idea of what we always want in our diagnosis in general, in our Heilkunst thinking in general, is a very, what we call a very rationalistic approach, right? And I say that word specifically because most approaches to healthcare, both in terms of the patient's mind and the practitioner's mind and the training and everything else, is all grounded in what's called the empirical approach. Empirical just means, we just look at the world, we kind of, try different things, we see what happens. And, it's basically what we do in everyday life. We kind of learn by experience, right? We learn, when we're young, hopefully don't put your hand on the stove because that hurts. And, we just have these empirical learnings in life. And those are valid, those are valuable. But I'm saying, as far as the whole structure of an approach, a healthcare approach, when, as most of the approaches out there are still doing pretty much a purely empirical approach. So as I say, that may be good for our individual day-to-day life, how we learn about the world and everything. But at this broader scientific level, we don't want that to be driving our healthcare conceptions. We want what I called a minute ago the rationalistic approach. So that is where we get more into the basis of universal principles and laws of nature, right? It's the rational mind which can understand the concepts and then what we do about it, of something like the law of gravity, right? Yeah, we may experience gravity empirically, on an experiential basis. I drop something and it falls to the ground. It's like, oh, what happened there? Like, oh, I guess there's gravity. But no, at the rationalistic basis, you can actually have this deeper understanding of the inner workings of nature. And especially when it comes to healthcare, this is what we need and want. So to this broader question, can you mix your Heilkunst treatments with other modalities? As I said to begin with, yes, in general, but now we need to be much more specific and take this rationalistic approach, take a very individual case approach, and diagnose every part of that case, every layer of the case. And the more you have that deep rationalistic understanding, you can actually safely and confidently mix two or more therapies together at the same time. Because when you rationally understand, what's going on in the patient's case, at this level, and what's happening at this level of the case, what's happening at this level, you can now, based on principle, you can apply the therapy that applies over here to this level at the same time as the therapy that's applying up here to this level, and so on. And you're not going to get into that problem. As I say, at the empirical level, people are correctly cautious to say, well, I better not mix all these things together because then we won't know what had the effect. As I say, empirically, that's good common sense. But we can go beyond that, and we want to go beyond that into this rational level where, by proper knowledge of principles and the what I was saying with the different layers, we actually can rationalistically layer in different therapeutics on top of each other. So I guess a good analogy here is like, if you've ever taught yourself how to juggle, well, the classic way to learn how to juggle is, you start with one ball, you just throw it up and catch it, throw it up and catch it. You just repeat that till you kind of get the muscle memory of that. And when you're ready, then you add in a second ball to the mix. And in fact, you can even start really simple with two balls. You can throw one ball up and catch it with the same hand, then throw the second ball up and catch it with the other hand. So just getting your two hands to kind of get used to motion. You're not even really mixing anything up yet. You're having one hand do something and then the other. And then you can start to do the actual movement where you throw one ball up, and before it lands in the other hand, you throw the other ball up. So you start to get this trading off of the balls happening. But again, you're gradually building up the skill set here, and on you go. You can put in the third ball, and then you get that classic three balls. And if you're really adventurous, go up to 4 and 5 and beyond. But this whole idea of adding in one at a time, I'm using this as an analogy for the way of diagnosis that we're talking about, and this rational understanding of principles. Is you start with the most basic fundamental principle, let's say we're starting with the law of similars, the homeopathic law of cure, and you really get a full, deep understanding of that. You practice that, just like practicing the one ball. You practice in different real life cases. Like when you're a student, you'll have your case studies and things like that. But this is you kind of practicing one ball at a time. You throw it up in the air and catch it again. You're mastering the one principle. But then over time, you can start introducing additional therapeutic principles or modalities or concepts and what have you, and you can start to really work up your whole juggling routine. So when you're doing all of that properly, now you're getting correct diagnosis, you can see the layers of the case, and you can correctly and accurately add in two or more modalities simultaneously. And it's not the empirical way. An empirical approach might do many things at once. They're kind of, what's that expression, they're throwing in everything but the kitchen sink. But when you're doing that empirically, that's actually not good. Then you do have that problem I said a minute ago, is, well, how do you know what had the effect? Was it this modality that got rid of the symptom, or was it this modality? Or you can never know because it's empirical, and it's just a mess. Basically, it's nothing. You can't derive any knowledge out of that. But what I am saying is, not on the empirical basis, but when you do what I said on the rational basis, like learning to juggle, now you have clear knowledge, clear principles, and what happens in the case, you can explain it in exact terms. What layer of their disease was going on, what modality was addressing that, what remedy did this or that or whatever. It's as clear to, what's the expression, as clear as mud, but in this case it's as clear as day. It's like you can see it so clearly, you can see the principles, you can see the effects, you can, through your diagnosis, what's what, and yeah, and away you go. So to kind of bring it around full circle, can you do other things at the same time as your Heilkunst treatment? As I said, the general answer is yes, but we have to be much more specific in our ability to train these capacities for diagnosis and understanding the principles of the therapeutics and bringing it all together in a very well orchestrated set of events. So yeah, the answer is yes, but also with a little footnote. Yes, but you need to make sure you understand what's going on at these different levels. You can't just, as I say, leave it to the empirical free for all, just throw everything into the pot. No, don't do that. But yes, do it in the way I'm saying. I'm just also remembering a recent Q&A video I did on the question of the three types of outcomes of any treatment. If you remember that, if you saw that video, we have a curative effect, a palliative effect, or a suppressive effect. I'm not going to redo that whole video again here, but just once you understand that rational principle of the effects of treatment, the effects of medicine or other therapies, you can see what direction different aspects of the case is going in, and on that basis, you can properly reevaluate if the treatment is on track, if the treatments are working, your modalities are working, and you can kind of keep everything on the straight and narrow in this really rationalistic way. So that's that's kind of the answer to that question. As I said at the beginning, if you have any questions either about this topic, about the mixing up of the modalities together, or if you're thinking of something else entirely, go ahead and type your comment in the comment box below. Same thing if you're watching this as a video replay, I will pick up those comments and bring them forward into a future video. And otherwise, yeah, I hope you got something out of today's video, and I will see you again in the next one.